Tonight, the American Cancer Society says 1 in 8 women will be diagnosed with breast cancer during their lifetime.
State says if it's caught early, nearly every patient survives that 5-year mark.
State House reporter Morgan Trout tells us lawmakers want to make sure all patients get that chance to survive.
Early detection is so important.
Screening early is important.
The early screening and the early detection saves your lives. It keeps you here for your children. It keeps you here for your families.
Doctors and survivors agree that the best way to stop breast cancer is to find it early. At 25 years old, Carrie Joy Coit was diagnosed with ovarian cancer. After her hysterectomy, she thought she was in the clear. But then during another visit at 30, she found a lump in her.
Cancer does not discriminate. It doesn't care about your socioeconomic status or your culture or your race. Explaining those things to people who have any type of indicator is extremely important now.
You used to have to fight for that 30-year-old patient to get a mammogram, even with a mass. We couldn't just send them if they didn't meet the criteria. And
Dr. Tara Scott is an Akron physician who says lives could be saved if there was more accessibility for early and supplemental screenings. Well, this could happen very soon. Bipartisan House Bill 371 is heading to the governor's desk. It would allow everyone, regardless of age, to receive coverage for an annual screening, including advanced screenings for those with dense breasts, which Dr. Janice Johnston says is more difficult to detect.
We'll encourage patients to have what we call supplemental screening in addition, whether that be through ultrasound or through a 3D type imaging or maybe even a breast MRI.
The bill requires Medicaid and insurance companies to cover these supplemental screenings. Dr. Scott says she's excited for the law, but there is more access to fight for.
There's still even that working poor, though, the people that don't qualify for Medicare or can't take time off work to go to get imaging. So it's a step in the right direction, but there's obviously always going to be access problems.
Coit agrees about making sure accessibility is equitable because outcomes aren't. The American Cancer Society reports Black women have more than a 40% higher rate of dying from breast cancer than white women.
I'm hoping that with the new law, that access to care is also going to be addressed by a lot of the providers and the people who are working, the nonprofits that are working hard to get people to the doctor's office.
The governor's team says he plans on signing it as soon as it gets to him. At the State House, Morgan Trout, News 5.